will keep an eye on them. Then we can, yeah, we're gonna keep an eye on them. So feel free to throw those messages in the chat box. Jackson and I will keep an eye on it. And if you guys have any questions, feel free to message me or Jackson. So a quick who I am. My name is Shilpi for anyone that doesn't know who I am by now. I've been doing this for about a semester. I'm a second year medical student at the University of Miami, and I'm on the executive board for our emergency medicine and wilderness medicine interest groups. And I'm also on the leaderboard for women in aerospace medicine, which is a subsection of the National Aerospace Medicine Student and Resident Organization. I'm the crazy human that's been putting this on throughout the year, and I'm super excited that you guys are all here. I've had an awesome team of people from both executive boards, and I have Jackson here today helping me out. So big thank you for that. New Year, same speech for those of you that are my repeat offenders, but I like to do this for all of my speakers. I created this project for two reasons. The obvious would be to expose interested students to the breadth of wilderness and emergency medicine. I personally think wilderness medicine is absolutely badass and it has lots of diversity. And I kind of just wanted to create an opportunity where us students could learn and engage with it well beyond the constraints of the environments that we're necessarily surrounded by of our schools. And then secondarily, kind of on a deeper level, you know, with the ongoing pandemic, I know it's still going on in 2021. I kind of wanted to create something that reminded both myself and all of you why we got involved or want to get involved with medicine in the first place, and to showcase the diverse spheres in which physicians can make an impact. So maybe it gets you guys to start thinking a little bit more abstractly about the ways in which we can use our careers in healthcare medicine, even if it's not wilderness medicine. So if you didn't know, now you do. We're all here to learn about mountain medicine. As you can see, I have a super big lineup of talks coming up and a few more in the works as well. As always, all the most up-to-date information can be found on my website. If you haven't had a chance to look at it, I'll throw it into the chat box. I did want to take a second to note that as I start this year, I'm going to start preparing for step one soon and transitioning to clinicals. And I won't really have the time to devote the need to run this show on my own. So given the inter-organizational nature of this endeavor, I'm looking for a group of hopefully highly motivated individuals from really anywhere that's interested in wilderness medicine and is passionate about it as I am to kind of hand this project over to. It's been an awesome project. I've gained immense networking opportunities. I've met a lot of you virtually, a lot of leadership skills, and if there's interest, I'd love to see this continue and grow over the years. So if you guys are looking for any sort of leadership opportunities in the realm of wilderness or emergency, please shoot me an email, send me a message in the chat, and I'd love to talk to you. So with that, it is my great pleasure to introduce our speaker today, Dr. Julio de Peña Batista. Dr. Julio de Peña Batista is an assistant professor of clinical emergency medicine at the Herbert Wertheim College of Medicine, Florida International University. He graduated from medical school at the Universidad Iberoamericana School of Medicine, completed his residency in emergency medicine at the University of Puerto Rico, and was a former coordinator for Hospital General Plaza de la Salud Emergency Medicine Residency Program. He is board certified in emergency medicine. He is a fellow of the American College of Emergency Physician, the American Academy of Emergency Medicine, and the Academy of Wilderness Medicine, and member of FEMA/Florida Urban Search and Rescue Task Force, Department of Homeland Security. Dr. de Peña served as medical officer for the first and second Dominican expeditions to Mount Everest. Furthermore, he is an avid photographer with his work being showcased in several venues, such as the book Soñado el Everest by Federico Jovin, Wilderness Medicine Session for ASAP Scientific Assembly 2011. So with that, please join me in virtual silent claps to welcome our speaker today. And I've been stopped sharing my screen. So.
Well, hello everyone. Happy New Year. Thanks for that introduction. Now that you put it that way, I feel on the spotlight. Can everybody hear me all right? All right. Yes. Well, first promise is I'll try not to bore you and kill you by PowerPoint death. I can't see myself, so I guess you guys can see me all right. So thank you so much for having me in this talk. I am so happy you guys are keeping up with the Wilderness Medicine Interest Group. I think wilderness medicine is badass. I agree with that. And there's many ways that you can get involved, and hopefully you guys can get involved in many possibilities in terms of wilderness medicine and many other aspects of medicine that you can find throughout emergency medicine for those of you interested in the long run. Let me start then. If you do have a question, please um, post it, or I am guessing we'll have a final Q&A. 1 second now.
Yeah, so we'll just have everyone post their questions in the chat as you go along. And if it's pertinent to your talk, Jackson and I roll and read them to you. Otherwise, we'll have a Q&A at the end that Jackson will help curate so everybody can ask their questions, if that works.
Okay, now let me see, because I am having great. We had it all set, and now I can't see it. We are going to share my screen in a moment. And can't find it. Hold on 1 second. Oh, there we go. My apologies. There you go. Here we go. Really? Hold on 1 second. There you go. All right. Let me know if you guys can see that all right.
Looks good to me.
Sorry for the delay. Well, so what we're going to do is we're going to have a wonderful trip into the Khumbu region of Mount Everest. I had the all of a sudden I'm on my home. I received a text message from a friend. How do you like to go on a trip with us? And this happened to be my reaction. Completely surprised, very excited. And going to Mount Everest as the team physician for this first Dominican expedition to the top of the world seemed like a daunting task. Um, and I wanted to, at that point, I was very involved in outdoor activities, but I did not have the slightest idea how to take care of people on such a remote environment. And we decided to ask ourselves why wilderness medicine, and the reality is because it's all around us. Wilderness medicine, I'll describe it as the caring of patients outside your regular setting. So you got to take care of people on a marathon event and there's a terrorist attack. You got to take care of people on tactical events with police involvement. We got mountain settings, and this is base camp, and I'll show you a few pictures of it. We go out on the beach, and we have plenty of accidents in the water, being on a so close to the water. Um, we got people hiking, we got cycling events. So wilderness medicine technically is applied on every possibility wherever you're not inside your regular setting of an emergency room or an office. And people do stupid things, and that's my proof right there. And if you don't believe me, I'll show you this one. Um, People do stupid things, and that's why I have a job, and I see that every day. So one of the few things we're going to talk about are the hold on, let me see if I can move this out of the way. The scope of wilderness medicine, we're gonna how to talk about how to improve our decisions in the emergency department and our common medical problems. And as I said, I promise not to bore you or kill you by PowerPoint, which I'm sure you have much better things to do at home. But I promise you're gonna enjoy this one. And how to prepare for travel and expedition medicine. So the question first comes, how do I take this setting, which is the comfortable on my own practice setting, and bring it into this? And by the way, this is Everest ER. And if you haven't seen or heard about it, I would encourage you to Google it. Everest ER is an initiative of Dr. Luan Freer, who I have the pleasure of knowing. She created this to care basically for climbers and Sherpas at the Everest Base Camp region. And this is basically their office or their ER. It's the highest ER in the world. How do you bring your formulary, everything you have, and put it into this setting? By the way, this is me trying to arrange the office or the ER of our camp at Everest Base Camp. And guess what? Everything you see on the back here over this area is basically supplies for the expedition. It has no medical need for me. So you're thrown in this uh, soup of things, and you got to sort and figure out how you're gonna cope. And the reality of wilderness medicine, you have to be very creative, as we'll see later. So how do you pack this? This is all I took for a Mount Everest expedition, and bring it into this compact equipment. And the question comes, how much should I take? What and what quantities do I take with? So it will depend. That answer will depend on several questions. How far are you going to be from care? If you're going to be just a couple hours away from medical care, you probably don't need any of this. But if you're going to be 14 days on a high mountain hike to be able to extricate somebody from that situation, then you might want to think of the supplies you want to bring with you. What are you going to be exposed to? Heat, cold, propense to musculoskeletal injuries. So you need to figure out how many in your party, how long are you going to be, how far are you from care, your level of comfort providing that care. Every time I go on an outdoor activity, I present myself as a physician because ultimately I'm going to get involved anyways. So first thing I do is, what do you have available for first aid or to care for somebody if it gets injured? Because ultimately I'm going to get involved, and I don't want to be caught by surprise. So too much to bring, it's going to tip your boat, obviously. So you got to consider what you're taking. Let's go a little bit into documentation. In the setting of your office or your ER, you're going to have all this paper document and now, obviously, medical records electronically. But in the setting of a wilderness spot, you don't have the luxury of computers. Sometimes you do, sometimes you, most of the times you don't. And you need to document what you're going to do with your patients. This is us reviewing a patient. Look, if you can see the burns, first degree burns, and maybe very superficial second degree burns on the face. And this is just all sun exposure. So these are things you need to consider what you're going to be exposed to. Your medical records, your own personal and the team medical record. What vaccinations do you need depending on where you're going? You can go to several websites to investigate what are the common diseases or problems that you have in the local region that you're going, and identify what kind of vaccinations do you need to have. And you need to do this with time, because as the team physician, you are responsible for the well-being of everybody in your team. But you need to know, if you need a vaccination that needs a 6-month schedule and you're 2 months away or 1 month away from your expedition, then you're out of time to actually get that vaccination. It might be a critical thing to consider. So you need to investigate this as early as possible. I would suggest having an interview via Zoom or present, or personally with all the team part all the members of the team that are going to be in the on the climb or the expedition, and find out about their medical status. And it's just not just a simple interview. This is a medical interview for you to find out what you need to know about this patient. What surgeries have they had? If they have a if they haven't had gallbladder surgery and they have right upper quadrant pain, you might consider the gallbladder. But if you know they already had their gallbladder taken out, right upper quadrant pain, your gallbladder is out of the differential. So you need to know these things about your patients. Their allergies, you need to know the allergies that they have. So all the medical information for your team's members, it's important to you and the time you're going to take care of these patients. Passports and visas, they need to be updated. Before I forget, any pending dental issue, and I would say any pending surgical issue, if you're going to be in a long time expedition away from care, if you don't want to have surgery in Kathmandu, you better have that gallbladder taken care of before you go. Any dental problems, you need to go to the dentist and figure what problems are there, because you really don't want to deal with a toothache in the middle of the mountain. So these are things that come up while you're evaluating your patients. In terms of visas, I would say Some visas require time to acquire. Some you can get right at the airport, but you need to know these things. One of the best resources is the Department of State. You go onto the website and you kind of get informed. Research is the key to a successful medical part of the expedition. Find out what you need to know about that country. What are the requirements of entry? What are the requirements for transporting medication? You do not want to get caught up in a third world country with a vial of morphine and then have to explain that you're the team physician, because some people will consider that as illegal drug trafficking, and you can find yourself in trouble. Many of these countries that have frequent regular expeditions understand the job and the place of the physician in the team, but you need to look the part. So those are things that you need to consider while you're doing this kind of work. Insurance. I cannot tell you or stress enough the importance of having insurance. If you need to be evacuated, that's not the time for you to find out your team members' emergency contact information, your evacuation insurance information. You need to have that all with you before the expedition, so you have all that information available. And these are things that you need to prepare in advance before you move on to the expedition, because logistics gets scarce in the mountains. So you need to have this available for you. I cannot stress this enough. And this is in no way a plug-in for Angel Guard or for Dan's, the Divers Alert Network. I'm not sure if there's any divers in the group. I'm sure they are. Divers Alert Network will let you have a rather cheap travel and expedition insurance, including evacuation, and it's on the cheap. So I would suggest you look into that. I didn't say that in the beginning. I have no financial disclosures, but if anybody wants to change that, I'm all open for it. All right. So what do we bring and how much? The reality is that there is not a real book on how much you need to take and what you need to take. You're going to have to figure that on your own. There's obviously guides into what you need. And my suggestion will be divide everything by system, or you can do a head to toe. So in the head, ears, eyes, nose, and throats, right? Conjunctivitis, otitis. So that will be pain medication, antibiotics, sore throats or strep throats. You need some antibiotics and pain medication there. Um, Conjunctivitis. So keep going. Respiratory, cough, anything related to shortness of breath, asthma, bronchitis, anything GI, abdomen, GU. So you keep going down and you kind of figure out what are the things you need to know. One thing I would say, you will need to have with you a pregnancy test, because any females in reproductive age with abdominal pain, first thing you need to know is there any pregnancy involved? I have canceled many people in the middle of the expedition because they have gotten pregnant or they didn't know they were pregnant, and then that's what happened. And then I need to know whether that baby's in where it should be or is not. So deploy everything in. I love Ziploc bags. It will help you, keep everything apart and the things that you know. I brought a lot of soft tissue related equipment, and the reality is we treated upper respiratory infections. So you need to know what you're dealing with and to have the amount of medications that you need. You need to be a little more aggressive whenever you're treating. If the patient is coughing and have some green sputum, maybe down here, you wait and see if it becomes infectious or not. Up there, highly recommend that you become a little more aggressive, or you could start antibiotics right away instead of being a little more conservative that you would be down here. So these are all my supplies. My suggestion also, make a small first aid kit for every member of the team. Put there some bandages, some band-aids, some painkillers. The last thing you want to have is somebody have a headache at 2 o'clock in the morning, come and wake you up. You are as tired as they are, and if they have some medication with them, they can take care of it on their own while you're trying. All this pack in these 2 small bags. Now, another thing to consider is who's going to carry those bags? Are you going to carry it? Because I can tell you, carrying anything above 15 pounds on a high altitude mountain trek or climb is excruciatingly painful. So if you have a 50-pound bag, you need to figure out who's going to carry that. If nobody's going to carry it, there's no point in bringing it because it's not going to go anywhere. So you have to figure out if there's going to be porters or is there going to be animals carrying all your equipment. How far are you going to be from that equipment? Some Everest expeditions will take your bag on the first day and you see that bag 2 weeks after when you reunite with them at base camp. So if you send your first aid kit in that bag, you have a problem in the middle of those 2 weeks, you don't have anything to use. So you need to consider all those. So this is Kathmandu. As you can see, a very organized city. And to be honest, I was always fascinated with it. And I was very fascinated that it blew my mind when I went there. And to be honest, and I'll show you why there isn't a day that goes by I don't think about going back. And hopefully that'll be soon. And this is when it gets real. You're in the middle of this cities. You also need to consider not just the high altitude. And sometimes you are in charge of caring not just for the team members, but for the Sherpa and support team. And you need to figure that out from day one. Excuse me, because these are things that are going to burden you. You only have 15 climbers, but then you have 50 support teams that also are looking for the doctor. Trust me when I say in these communities, whenever there's a doctor, everybody will want to see you. So be aware of that situation and be kind to the people that you're there. You're a visitor and you should, I mean, at least the way I see it, I think we have a duty to provide our services and our care. And you could get technical and legal arguing that this could be practicing medicine without a license in a foreign country, but in reality, people don't really bother with you. They just want some help, and I'm happy to do that with no problems. Part of the sightseeing in Kathmandu, this is the Buddhanath. It's like an 800-year temple. They're very religious, uh, humble people, amazing, loving and caring people. So let's get into Kathmandu Airport. This is what you face at Kathmandu Airport. As you can see, it's very hectic. Flights from Kathmandu to Lukla Airport are scheduled, however, not guaranteed. It all depends on weather, and weather comes in really quick and fast. So we came in at 5 o'clock in the morning at the airport to get our first flight, and we ended up flying out like around 2 p.m. because the weather wouldn't clear. So in expedition medicine, you need to bring good books and good way to entertain yourself because you're going to be sitting and waiting for a long time, many times doing nothing but looking to the ceiling. So sometimes it gets boring. Anybody see what's going on down there? I'll save you the misery. That is the view from the cockpit into the landing strip at Lukla Airport. And if you don't know this, Lukla Airport is at 3,000 meters above sea level. It's been recorded as the most dangerous airport in the world. Me hating flying, however, will fly anywhere at any time. This is a scary proposition. I'll tell you why. Because Lukla Airport has a 1,000 feet drop at the end of the runway. It's inclined in level to help out with speed going down and to slow down coming in. And right here, there's a, a wall. So you either fly or fly. You don't have a second time term. This is a mountain right here. So it gets a little scary. It's called the Tenzing Hillary Airport, mostly known as Lukla, about 3,000 meters. This is where you start feeling the altitude. Most of the common things that we deal with are dehydration. People don't drink enough at altitude, and it's because you really don't feel like drinking and you don't feel like doing much. You don't even want to get out of the chair. It's just that tiring. You feel like sleeping all day. Excuse me. Injury due to extreme temps, soft tissue, and altitude, pulmonary edema, and cerebral edema. Obviously, individual conditions. Hypocaffeination, it's one big deal there. So make sure you bring your coffee. I cannot live without it. So I make sure I have plenty of it and ways to make it. Remember, everything you bring, you need to make. Lukla and Kathmandu, not to mouth them, but they do counterfeit everything, including Starbucks. And they think they did a pretty good job on this one. Coffee's actually pretty decent. up here. You do have internet, and now you actually have Wi-Fi throughout the mountains. So it's becoming a little more technical, and with the Wi-Fi and everything. And you do have your Irish pub. You can't miss those. So the principles of rescue and altitude medicine are A, your safety for rescuers, equipment, and victim. Scene safety, you heard this before. Always let the victim know you're coming. Do not surprise them. Remember that the victim's temperature is not the same as your own. You are working, you are sweating, you are tired. The victim is on the ground, and they're freezing. So use the victim's gear, not yours. You will need it. They will need it too. So make sure they have theirs. And the ABCs, a little different from the ones we always known. This is by Dr. Eric Wise, one of the leading authors in wilderness medicine. You got your A, 1, 2, 3, B and C, assess the scene, airway, and alert others. For B, barriers, breathing and bleeding. And C, CPR, C, spine. And one I like to emphasize a little bit is cover and protect the patient always. Um, as I said, you got to be a little more creative with wilderness medicine. This is by Dr. Paul Auerbach, another wilderness medicine guru. And this is one way to keep the airway open. It's just a little barbaric, but just to show you that sometimes in extreme situations, you need to come up with extreme ideas to perform and or get what you need. I like this one better. The March, massive bleeding, airway, C, spine, respiration, circulation, hypothermia, and hike versus helicopter. Let me tell you this. Carrying a victim through rough terrain for hours and hours, it's an impossible, tiring task. It gets people in danger. It gets the victim in danger. If that person can walk out, they will walk out, even if they're hurting. But they need to walk. It's you're compromising the whole team by carrying somebody. So you need to commit uh, to either carry that person out or evacuate them and alert early, because the fact that we have a cell phone now and have signal, that doesn't mean you do in remote areas. So be careful with that. Your secondary survey, I don't want to bother you too much with that. Sample is a good way. Symptoms, allergies, meds, past medical history, your last meals and event leading. And for pain, you know all this. I'm not going to bore you too much. And the secondary survey in terms of level of consciousness or outer mental status, AEO tips is great. I'm pretty lazy, so I use a lot of mnemonics to help out. And your physical, from head to toe, you need to evaluate your patients when something happens. So high altitude, what is the determining factor is the rate of ascent. I'm not sure if you know, but the people that get more high altitude sickness are the fittest ones. And the reason being is that they are capable of running up that mountain. Uh, and the reality is the higher and faster you go, the more likely you are to have altitude sickness. And the high altitude that you reach that day is also an influencing factor. The sleeping altitude, there's a saying, climb high, sleep low. And that goes for wilderness medicine in terms of altitude. If you reach a higher altitude, you're supposed to come down a little bit, at least 200 or 300 feet, and sleep lower. And in individual physiology, not physical fitness. I have seen tria, tria, triathlon runners get high altitude, and I've seen very out of shape people be fine. So it has nothing to do with physical fitness. This is one part that surprised me. The Sherpa community up there, this is what they carry throughout the trip. They can carry up to 110 pounds on their back, and they get paid about $10 a day to go up the mountain, bring all your equipment up. And us Westerners are struggling with a 15-pound um, pack. So just so you know how acclimatization works. So in terms of prevention, don't sleep higher than 600 meters. Your number to keep an eye on is 2,500 meters and above. You can get high altitude at any level above that, even 2,300. So climb high, sleep low. And avoid climbing about 3,000 meters in one shot. And if you do, stay for 3 days and rest. And when you see rest, is rest. No alcohol. I don't agree with all policies, but it's there for you to look at. Don't drink and climb. So moderate exercise while you're acclimatizing. Time is the issue. Hydration is the issue here. I'm going to go through this one really quickly. This is what happens. You got your lungs, and your lungs get increased artery pressure, and then it produces pulmonary venous constriction, and then it produces pulmonary edema. On the brain, produces vasodilation, increased blood flow, and then it produces edema. For any of you that want to learn all this, by all means, but just so you know, it happens by different methods, but ultimately it's the same. You get fluid overload, and it's all because of hypoxia. This is us at 2,800 meters. Now we got a 72% O2 saturation, and we're coming into the park, walking towards Everest. So the prevention and treatment of acute altitude illness. I'll tell you this before you get bored with all this. Low means low probability in stratification of patients that could get it. Individuals with no history, they're not ascending over 3,000 meters. They're low. Moderate, if you have a previous history of altitude mountain sickness, you're going to go above 2,800 in one day. And then you got your high, which if you have a history, you're climbing about 2,800 or 3,500 in a day, you have altitude pulmonary or cerebral edema, all these people might need to be treated with acetazolamide, which is the treatment or prevention for this. Now, this is a fascinating city. It's the capital city of the Khumbu region, and as you can see, it's been there for millennia, and it's the capital region of the Khumbu Valley. This is where you spend a few days acclimatizing. And as you can see, it's a large thriving communities. You got here, just so you know, you got bakeries, you got Starbucks style coffee shops, you got Wi-Fi internet all over, you got little shops for your climbing equipment, massage rooms. It is pretty dope. And it has the highest, I've been told, it has the highest English pub in the world. This is what I've been told, now that I visited 1 or 2 times while I was there, maybe 3 times. I was told 3 times. So as you know, when you're walking through the Khumbu region, these are the type of villages that you encounter. Watch this. This is such an amazing place. Look at this. You're not living on the base of a mountain. You're living on the base of, oh my God, this is just like lunar surface scenery. And it's so beautiful in the early mornings. And you're coming through these trails and then up the mountains. And you keep on walking towards what you end up being Everest Mountain right there. You can barely see it behind the mountains over there. While you're walking through the regions, you can see the greatness of your scenery around you. It's just amazing the way this looks while you're going through this. This is Everest. And do not think this is an isolated place. It is at some levels, but in the beginning, you can see crowds of people just trekking around the area and looking and enjoying the scenery because it's just a beautiful place to be. In classifications of acute mountain sickness, I'm going to put it very simple for you. Mild, it's mild symptoms. You have to have headache. If you have diarrhea at altitude, you don't have acute mountain sickness, you have diarrhea at altitude. All right, let's get that out of the way. You have to have headache. And in order to be mild, it needs to be a mild headache. With moderate headache, you get a little fatigue, lassitude, dizziness, some difficulty sleeping, nausea and vomiting, and high altitude cerebral edema. is where the problems comes. It's when you have all of the symptoms, headache, nausea, vomiting, fatigue, dizziness, difficulty symptoms, they're severe enough, plus you have ataxia. Once you reach ataxia, which is you can't walk straight, if you remain at altitude, you will die. Simple. So let's keep that in mind. You need to bring that patient down. For mild and moderate symptoms, you might get away by just staying at altitude, but you don't want to, if symptoms are worsening, you need to start coming down. So think about this. So remember the movie uh Hangover? That's what altitude sickness feels like. Headache, nausea, my dizziness, lassitude. So that's kind of where it's at. Cetazolamide is a prophylaxis, dexamethasone. Ginkgo biloba is here because it doesn't work, just so you know. Nifedipine for pulmonary edema, and salmeterol for pulmonary edema also. This is the vastness of the place. The longer and the deeper you go into the mountains, the more isolated you are, and the smaller you feel. While you're walking down these places, you can see these mountains rising 3, 4, 5,000 meters right next to you, and it's just an amazing feeling. Uh, at this level of saturation is about 61%. You will be tubing somebody down here, but up there you're struggling, but you're not intubating patients all over. So the effects are a sleeping altitude about 3,600 meters is most common at the second night when you have pulmonary edema. Symptoms: dry cough, your tachycardia, shortness of breath, difficulty breathing at rest, cyanosis, wet rails. If you have fever, then that's probably a pneumonia, but I would still treat it as high altitude pulmonary edema. I wouldn't not treat it. Rest, oxygen, descent, nifedipine, acetazolamide are on the treatment regimen for this patients. This is where you get to be blessed on your climb. These are all the Sherpas, climbing Sherpas. Every Westerner usually goes with a climbing Sherpa that accompanies them throughout the mountain to help them out in their chores. And this is the last place remaining before you get to Everest Base Camp. So this is as small as it gets. This is fairly flat. It's about 3 miles walk. And if you can believe it or not, the first time I walked it, it took me about 4.5 hours just because I was so out of breath initially. After 2 or 3 months there, I could make that hike in about 45 minutes. That's how much of a difference when you're acclimatized at altitude. And you will come here because you were so isolated and sometimes so bored, you just needed to grab a burger or a beer or get some Wi-Fi. Now it's a little different. You get all those stuff sometimes at base camp. And we will talk a little bit about more about base camp. This is me reaching base camp. This is the touristy part. This is 5,360 meters. This is where the tourists come and come back. If you're climbing, you keep on walking deeper into what it's come the highest man settlement um, temporary for about 3 months. You get about 2,000 people living at the of this moraine, and this is all covered with stone, but it's actually ice underneath, and it moves. This is what's called the Kumbu Icefall, and it moves. For you to have an idea how much it moves, somebody fell on the top of the icefall about 10 years ago, and the year we went, 10 years later, found the body somewhere around here. So it came down. I'm going to show you how fast it came down. There's our base camp, kitchen tent, dining tent, and all of our tents scattered around camp. It looks like a lunar surface. It gets really cold. Um, you get your avalanches. You need to prepare for those because those are a frequent events, and you can hear that roaring in the middle of the night while you're sleeping. This is my tent right here. It was scary the first time I heard it in the middle of the night. And like any other homestaying, you need to do your chores. As this is the shower house. We're doing some clothes washing. So it is, sometimes it gets boring, but sometimes it gets interesting, and we're going to talk about that. There's Dr. Luan Freer with Everest ER. As I said, she created this about 10 years ago, and she takes care of climbers and mostly Sherpas that don't have medical care or support. This is their setting. This is all they got, and they do charge. They don't charge the Sherpa community. So if you want to join Everest ER, contrary of what you might think, there's probably a 3 or 4 year wait list for you to come and volunteer for 2 months in this place. So if you think it's open for anybody that wants to come in, yes, it is open, but you're gonna have to wait. But it's a very exciting opportunity. I haven't had the opportunity to work here. I did have some interactions with them while I was there, but it's an opportunity. EverestER.org. So I just want to show you what the Gamo bag is. This is a rubber sausage where you can put the patient in, inflate it, and it feels like you're bringing them down 1,000 meters. It serves you as treatment and as diagnosis. If you have a headache, you put the patient in here, you bring them down 1,000 meters. The headache is gone, it's high altitude. Headache is not gone, you have a headache. But it can save someone's life. It's actually pretty light to use. You can see as a window, you can see your patients. You zipper it up and you cinch it. It's actually pretty cool. A little humor just to bring home the point that communication is key in an expedition. You need to say when you're feeling something that is not right. Nobody wants to be that guy that holds the group down. Nobody wants to be that guy that breaks down first. But the reality is, if things can be taken care of just by speaking and you don't, and then it makes it much worse, then you're compromising the integrity of the whole team. So we need to speak up when something's happening. So when I was speaking about that body, that climber fell off around here. 10 years later, we find it around this area. So this is the Kumbu ice fall. This is ice. It all moves. So this is Everest Base Camp, 5,300 meters. This is Lhotse, and this is Everest top. You don't see Everest from the bottom. You have this shoulder that won't let you see it. But if you climb up high, this is base camp right here. I don't see if you can see the yellow parts. And if you can, this is the climb to Everest. So this is camp 1, camp 2, 3, 4, and then top and back. So this is how acclimatization works. You come here, you spend about 1 or 2 weeks here. Then you make a climb to camp 1, sleep there, spend a day or two, come back, rest for a week because you're exhausted. Then come back to camp 1, sleep there 1 day, then come up to camp 2, sleep there 1 day, come back to camp 1, and then you go on a stepping stone up and down the mountain. So you climb half of the mountain several times until you're ready to push. So this whole acclimatization and climbing takes about 45 days of you acclimatizing. And the reality is, if you walk from Everest Base Camp to the top, it will take you 4 days if you didn't need to acclimatize. But if you were dropped suddenly on the top of Mount Everest without acclimatization, you would die pretty much 30 or 40 minutes after. You are at 28,000 feet. That's the flying altitude of a commercial jet liner. So it is high and it's cold. It's minus 40 Fahrenheit. This is us evaluating our patients. Just so you know, by me sitting at base camp, this is how your metabolism goes. By me sitting at base camp and not doing really much other than taking care of patients, the occasional patients, walking daily about a mile or two slowly because you're almost out of breath all the time, and eating chocolate and everything that could come my way because you're bored, you're tired, you're excited, you're anxious. I lost 45 pounds just sitting at base camp. That's how your metabolism is running on high. So it's a great diet if you want to ask me. Ways to evaluate your patients. If you got a carotid pulse, you at least have a 60 or 70 um, of systolic blood pressure. If you got a femoral, 70 or 80, and your rest at least 90. So these are ways for you to kind of guess. Duct tape is it's like the force. It has a dark side, a light side, and it keeps the universe together. I will not go anywhere without it. It's a great tool to have. Treat blisters, hold things together, and just great ways to repair things on the field. Irrigation, Ziploc will do it. Tourniquets are back in play. Military style will prevent a massive bleeding, but you can use your a bandana. There's an old style, and these are the all the commercial military stuff that we use to prevent hemorrhaging. But to be honest, unless there's a big, massive accident or casual event, you probably won't need this much. Triangular bandage, bandana will do. This is just an illustration I saw in a fortress in Spain. Just determining how old people have been using this. And lacerations. You tie your hair together, you dermabond it, or you clip it. Sam's Plan, again, I have no commercial relationship with them, but it's a great piece of equipment. You can mobilize any limb with it. As you can see, this is from the beginning of the trip, but this is when it becomes real. This is when the climbers sign what they want their bodies disposal to be if they die in the mountain, if they want to be rescued, if they want to be thrown in the crevasse, or they want to be cremated. This all counting on the fact that they can get to your body. So this is serious stuff, and you need to be aware of this. You need to have this conversation with your climbers. What do we do if the worst happens? This is the first day of celebration. One of these climbers had an issue at 7,000 meters. I get this call, and he collapsed in the middle of the mountain. They did CPR for about an hour. We all know that it's a long shot, even in the best settings. So things do happen, and I have to do medical control over the radio with this. And I just want to show you a little graphic really quickly of what happened on the earthquake.
Dr. DePena, just so
Yeah.
you know, the sound isn't playing for us. So could you just summarize, I guess,
Yeah.
gist of the commentary for the video for all of us?
Yeah. So this is just the disaster earthquake on Everest Base Camp. Over 23 people died there. I have several friends that were climbing. It was a disastrous day. If you're a physician there, one physician actually died on that. Um, how to improvise an airway, tracheostomy, ways to carry patients, very extraneous work. I'm almost done. Happening every day, evacuations. So rules about altitude. You don't feel well, it's altitude. Do not continue ascent and stop. You're getting worse, you got to descend. This is basically the uh, first photo of the climbers to Mount Everest, Tenzing and Edmund Hillary. And that was our final picture when we made it to the top. I was at base camp all the time, but this is how we did it. And just a little thought for you guys. Sorry, I have to rush it at the end, but we do get involved in situations that we're going to need care. And in extreme situations, if you're prepared to provide care, you are a very much needed resource. If you guys have any questions, that's my email. You can follow me on Instagram. I do post most of my photography work in the mountains or in teaching there. And obviously, if you have any questions, I'm more than happy to bring it over. Thank you, guys.
Yay, thank you so much. That was such an awesome talk. It definitely gave me a lot of FOMO having been in the Khumbu region myself. We had a couple questions submitted and Jackson's gonna help curate the Q&A and we'll open up the floor for anybody as well that wants to ask any questions before we get out of here. So Jackson.
So there were two questions that people asked during the presentation that I was going to go through. So the first one was from Laura Menendez, who's also at FIU. And she said, good afternoon, Dr. De Peña. How do you establish or obtain the baseline of what is normal for vitals for individuals in an area at such a high altitude?
That's a great question. I don't really look at vitals, to be honest. It's going to sound kind of weird. Vitals are very difficult to identify in a high altitude setting. Pretty much the only vital I go with is the saturation. I hardly use a stethoscope. I do have it. It's just difficult. So clinical presentation of the patient, how they look, are more resourceful than taking a heart rate or a respiratory rate. Obviously, there's parameters above 100 is tachycardia, but people are anxious, are in pain. How they look is more important, and the saturation is the one I look at the most.
Great, awesome. The next question is from Alaba from Syracuse University, who asked, when you use duct tape, do you put sterile gauze between the adhesive and the wound, or does the adhesive go directly onto the injury?
No, good question. Good question. I make some sort of a donut on the gauze, so the injury kind of stays in the middle, and then I duct tape on top. You'll be lucky to have sterile gauze by all means. This is just temporary most of the time, but not duct tape on top of the wound. You are absolutely right. So I make some sort of a donut or a cushioning in between the injury, then some gauze on top, and then the duct tape. It's mostly protective.
Great. So coming up next, James from Western Michigan wanted to know, what camera gear do you bring or use when you're trekking?
That is a topic on itself. I would love to talk a lot about it. But I do bring a small Canon D50. I used to have a Sony A6000 and a Canon 5D Mark III with all the lenses. But you need to figure out who's going to carry all that. I've been lowering on my gear, but have a lot of batteries, a lot of plugging devices for charging, and a lot of SD cards. You can email me. I can send you a list. That's a good one. I struggle with that one all the time.
And the last question, I think it's the last question that we saw in the chat for now, is could you explain how to improvise an endotracheal tube in more detail? The pick went by pretty quickly.
I like that. I'm sorry about that. It was so you get your ambu bag or your ambu bag. You get your IV drip, the reservoir on the top, right? It has a spike that goes into the IV bag. So that's the spike that goes inside the trachea. So you cut that So you cut the reservoir in half and you kind of connect that to an endotracheal tube, 7 or 8, and that will make a connection and then into the ambu bag. It's not perfect, I can tell you that, but it's a way to connect it all together. So the spike that goes into the IV bag is the one that you're using. I can email you the photo if you send me an email, please. Well, I only done it in mannequins. To be honest, I haven't done it in real life. But it inflates the lungs. But hopefully I don't have to find out in real life, but at least I know a way to do it. So this, remember, wilderness medicine is ideas on how to do it. Most of the time, you're not going to have everything that you learn how to do a stretcher with, but at least you have the idea of what kind of materials you can use and how to kind of build it. Same as shelters goes, same as wound care. So it's kind of having ideas and kind of adapting to what you need.
All right, and then someone actually just asked another question in the chat. Tran asked, so emergency medicine in the mountains sounds scary when you're so far away from a hospital. How does one overcome those fears, and what character traits would someone need to be a mountain doctor?
There's no way to. You pray to God that nothing happens every day, and then it becomes as boring as possible. It is scary because you don't have what you usually have at your disposal. I don't think that there's a way to overcome those fears. I think that knowing what you know and knowing what you can do and you can provide care is your best weapon to actually try and do something. And sometimes you're not really doing much in terms of medical, but having a voice of calm and knowing what to do medically, even if you cannot do it, you can guide people. Because remember, let's imagine on that earthquake and base camp, many people didn't know what to do, but if you at least can triage the patients, okay, the woundeds go here, put pressure on that wound, wrap that thing, help this guy walk out. So at least you know what medically needs to be done, even if you cannot do it. But at least there's a certainty that the knowledge is there and that you can provide it when the opportunity comes. Sometimes you cannot, sometimes you can. But having that voice of knowledge there calms a lot of people, trust me.
Cool, and I think that was pretty much all the questions we've seen so far. If anyone else has any other questions, speak now, or I guess you could also probably reach out to Dr. De Peña.
Yes, please
over
send me
email.
an email, and I will be happy to get back at you and give you any details of any experience that I have and anything I can answer for you.
Yeah, if anybody has any questions, we'll like open up the floor if people want to talk for themselves too. But otherwise, yeah, you can always forward your questions to me, to Dr. De Peña, but we will get you your answers. But yeah, floor is open for anybody. If there's any.
Thank you everybody for having me. I'm sorry it kind of felt like it went fast at the end. I just get so excited. I get entertained with it. I pretty much don't bother with the clock. But thank you so much for having me and for you guys for your time. And if you guys need anything, please let me know. Contact, reach me. I'm always open to have a discussion about this. I love this topic, and I will go on forever if you let me.
Yeah, if there's nothing else, thank you everybody for coming. Dr. De Peña, thank you so much for your time. I know you're incredibly busy during this crazy time that we're living in. Everyone, thanks for coming. Have an awesome evening, and hopefully see you guys next week. We have desert medicine on the lineup. And yeah, feel free to email me if you have any questions that you want me to get answered for you. And yeah, have a good night, everybody.
Thank you, guys. Be safe. Wear your mask.
Bye. Yeah.
Bye, guys.
Is it okay if I ask a quick question? I tried to put it in the chat, but it didn't work out.
Yeah,
I'm still here.
Yeah, so do you ever encounter any wild animals while you're up in the mountains?
Do I have any what? I'm sorry?
Do you ever encounter any wild animals while you're at the mountains?
That's a good question. No. The reality is they are afraid of us. And once they hear us or feel us coming, unless you surprise them in the wilderness, they're usually not there for you to, encounter them. I mean, I guess it does happen, obviously, but I have never encountered any situation with an animal because they hear us and they flee. That's most of the realities. Most of the encounters where there's a dangerous situation, is when you startle the animal and you surprise them and they have nowhere to go and they do attack. But if they can hear you coming, or if there's an area that you know that they'll be there, if you make noise and let them know you're coming, they pretty much won't be there.
Thank you so much.
Not a problem.
All right, y'all. It's time. Have a good night, everybody.
Thank
See
you
you
guys.
next week, hopefully. Thank you again, Dr. Peña.
Not a problem. Bye-bye.